Good morning. Welcome to the PTNI's Daily Show. Happy Thursday morning. I hope your day is off to a great start. My name is Alan. I'm happy to be your host today. Currently have the pleasure of serving as the Chief Operating Officer here at ICE and a lead faculty in our fitness athlete division. We're here on Leadership Thursday. We talk all things practice management, ownership, small business leadership. It is a Leadership Thursday, which also means it is a Gut Check Thursday. Our Gut Check Thursday this week is the Ignite workout for our partners over at Forging Youth Resilience, better known as FIRE. It is a workout that's going to be done at gyms across the country this month to raise money for FIRE, Forging Youth Resilience, the shirt I'm wearing today. They are a nonprofit organization that works to get young people into the gym, get them connected with community-based fitness, mentorship, nutrition, in order to change the trajectory of their life. They primarily work out of CrossFit gyms where they have special classes just for the FIRE kids. Our goal this month at ICE is to support FIRE, specifically to support getting kids to the annual camp out in Boulder, Colorado in July. So for the month of May, any donation made through our donation page, which you can find as the top link in our bio on our Instagram page, any donation made will be matched one for one up to $10,000 from the ICE Foundation. Jeff and I will actually be going out to that camp in July to join the kids and hang out and teach a couple sessions with them later in July. So that's a little bit about FIRE. The workout, the Ignite workout, two-part workout, starts with a metabolic conditioning piece, 21-15-9, thrusters at 95-65, lateral burpees over the bar, and then ab mat sit-ups. This is all being done on an 18-minute running clock. And once you finish that 21-15-9, any remaining time is yours to find a max complex of the following complex: one hang power clean into one full squat clean. So ideally you're getting done maybe 8 to 10 minutes with that Metcon, and you are having 8 to 10 minutes to have a couple chances at that heavy complex. I'm actually going to do it later today at lunch, so I'm excited to see how it goes. Thrusters and burpees, never a good combination. Very redundant movements with the vertical and horizontal pressing. Doesn't feel the greatest. So that's the Ignite workout. That's Gut Check Thursday. Courses coming your way. We have a whole bunch coming your way next weekend, the weekend of May 20th and 21st. We have cervical spine management in Fort Worth with Jordan. We have bike fit out on the West Coast in Bellingham, Washington. That'll be with Jason and Matt. We have two chances at Fitness Athlete Live, either in Boston with Zach Long or Rockville, Maryland with Joe Hanesco. We'll have extremity management down in Hendersonville, Tennessee, right outside of Nashville. And we'll have an older adult live triple header. We'll have Christina in Charlotte. We'll have Julie out on the West Coast in Simi Valley, California. Or we'll have Dustin in Phoenix, Arizona. And then we'll have upper body dry needling here at Health HQ in Michigan that same weekend. The weekend of June 3rd and 4th, we have Pregnancy Postpartum Live in Hendersonville, Tennessee, lumbar spine management in Charlotte, lumbar spine management in Casper, Wyoming, or again, another chance at upper body dry needling in Atlanta. And then some online courses coming your way. If you'd like to learn from myself in the fitness athlete division, we have Fitness Athlete Essential Foundation starting June 5th. And then we also have persistent pain management and primary care physical therapy starting June 5th as well. As always, ptnice.com, resources, newsletter, free CEUs, courses, everything lives on our website. So let's get into today's topic. We're going to begin a 4-part series. So we just finished a new leader series of some tips and tricks when you're first getting your business off the ground. And part of that, for some of you, maybe most of you, are going to be questions surrounding Medicare. Should I take it? If I want to take it, how do I take it? How does it work? I don't really understand. It seems to be very complicated. So we asked the ICE students page, hey, what is something you really want to learn about? And a lot of folks said, I would like to learn more about Medicare. I would like to learn what it is, how it works, how I can take it. Should I take it? Is it worth it for me to take it? And for some people who are already accepting it and billing it, what are some tips and tricks? What is the actual rules around documentation? What do I need to document? I feel like I'm writing too much for my patients who are using Medicare insurance. What are the actual rules, guidelines, tips and tricks for those of us who are already in a clinic that is accepting Medicare? So we're going to cover all of that over the next couple weeks in a 4-part series. Today, we're going to start very basic, and we're literally going to talk about what is it? What is Medicare? We'll build into how to take it, should you take it, and then we'll finish with the assumption that you have either decided not to take it or that you're already taking it, and tips and tricks, documentation, rules, what do you actually have to write down, that sort of stuff. We'll finish with that at the end of the series. So today, part 1, what is it? It's this mysterious thing. It's related to the government somehow. What is Medicare? In the simplest terms, Medicare is a federal nationalized healthcare program for individuals age 65 and older. There are some folks who you will see in the clinic who are under 65 who qualify, and that's based on a verified disability with the government due to usually some sort of chronic lifelong illness that they may have had since birth or acquired earlier in their life. So it's totally possible to see somebody come in the clinic who might only be 35 years old but carries Medicare insurance. For those who are waiting to get it based on age, folks become eligible the first day of the month in which they turn 65. So if my birthday is March 31st, on March 1st of the year that I turn 65, I become eligible for Medicare and I can start using Medicare as a form of my health insurance. For those of us who are not yet eligible, you see the money related to Medicare coming out of your paycheck every month. Whether you're W-2 and you see it every pay period, or you're 1099 and you pay into it every quarter or at the end of the year, something like that, you see those Medicare taxes come out of your check. Where do those go? Well, if we're being honest, those go into a pool of money for the people currently using Medicare to have. So you are essentially paying for those folks to have Medicare insurance right now. And it's kind of this system where we hope that the people coming behind us will also pay into the system so that we can have Medicare. And that's kind of how it's been going for the past 100 or so years that it has been around, that the current generation in the workforce pays taxes that go into the pool of money that pays for all of the services for Medicare of the folks currently eligible. As those folks move on in life and leave us, we become the Medicare eligible people, and we hope that the people now in the workforce behind us pay into it. So that's essentially how it works. It is a federal program, which means it is a little bit different than billing, for example, Blue Cross or taking cash. And that if anything goes wrong with that, it's likely going to be a civil issue where you may get sued by the individual patient, or you may just get in trouble with that commercial insurance company. Because it's a federal organization, because it's a governmental organization, the penalties surrounding fraud, misbilling, treating customers wrong who carry this insurance are a lot more severe. Usually can result in suspension or loss of license, really heavy fees. We'll talk about that later on. And in some cases, in really rampant intentional Medicare fraud, up to 10 years in federal prison. So because it is associated with the government, specifically the federal government, any sort of issues that come along with it are a lot more severe. So you should know that getting into it, especially if you're thinking, how can I see more Medicare patients that I'm currently seeing? You need to be really careful with following the guidelines, which we'll talk about in the later weeks as we get into more specifics around billing Medicare. What are the different ways that Medicare presents itself? In the outpatient environment, we are used to seeing patients who have what is called Medicare Part B. This is Medicare coverage for outpatient care. It does cover some medical supplies and it covers some prevention services. This does have a monthly premium. It costs about $165 a month currently. And if folks don't pay their premium long enough, and they're delinquent long enough, they can lose their Medicare coverage until they pay all of their back premiums and get caught up. So it's entirely possible for someone to come into your clinic with that red, white, and blue Medicare card and think they have coverage for physical therapy, and you go to bill it and it gets rejected and it says patient not found, or patient has some sort of issue, and it turns out they haven't been paying their premiums. That's entirely possible scenario. So it's not just free healthcare for the rest of your life once you turn 65. It does have a cost to it. Now, how do we pay for that cost? You need to pay into Medicare for what Medicare calls quarters. They call a quarter a period of 3 months of paying the Medicare tax in a subsequent row. So it's entirely possible to be working for 20, 30, 40 years, but not yet have achieved those 40 Medicare quarters because maybe there was a break where we did not have 40 consecutive 3-month periods of paying into it, a result of 120 months total. But again, they have to be in those consecutive 3-month blocks to build up to those 40 quarters. Once you've covered that, you've paid in your due, and now you just pay your monthly premium once you turn age 65. If you have not paid in enough when you turn age 65, you will have to pay the difference between what you were supposed to pay in Medicare tax and what you actually paid to get caught up before you're eligible to receive Medicare coverage. So that's Part B. Part A, we don't see too much in outpatient or at all because it's mainly inpatient services. Part A is something everybody gets as long as they've paid into Medicare with Medicare tax, and it has no monthly premium. It is guaranteed as long as you have paid in enough to Medicare. This traditionally covers inpatient hospital stays, skilled nursing, hospice, and it also covers home health. So again, you must have paid into it. If you have not paid enough Medicare tax, Part A also has a premium, or you'll have to pay the difference between what you owe and what you actually paid. And then Part D, we don't deal with at all as physical therapists. Part D is prescription drug coverage. Traditionally, Medicare works on an 80-20 split. So when someone gets charged for a service using Medicare, Medicare will pay 80%. And the patient is responsible for 20%. This is essentially a built-in co-insurance or copay. So if we bill a patient, using very easy math here, if we bill a patient $100 for physical therapy, Medicare is going to give us $80, and it's going to say, hey, you need to charge John $20 for his physical therapy visit. So again, some folks will come into our clinic and say, I have Medicare, and they think it's 100% universal, free coverage. There's no cost to them. That's not true. They have a monthly premium that they need to pay to be covered, and they also have to pay that co-insurance. Some folks will come in with a secondary insurance that covers that extra 20%, and when you bill Medicare, it will automatically send it to that secondary company for them to pay the remainder. Some folks will also come in with what's called a managed Medicare plan. This is a Medicare plan through a commercial insurance company. How this works in the simplest terms is that the patient has essentially signed over their Medicare benefits to a commercial insurance company like Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, whatever. Now that company is managing the Medicare benefits for that patient. Almost universally, this is a bum deal for everybody. In general, managed Medicare pays less than pure full Medicare from the government. The patient usually pays more of a premium to the managed Medicare plan, and they usually have a higher copay, and they may even have a deductible. So in general, everybody loses but the insurance company, which is true of most insurance companies. The patient is going to pay more. The physical therapy clinic is going to receive less. So that's the nuts and bolts of managed Medicare. The downside, especially to managed Medicare, is that if you have aims of being a cash-based practice and maybe just accepting Medicare, you also have to get in network with those commercial plans to be able to take the managed Medicare plan. So you have to get a little bit deeper into the insurance rabbit hole than maybe you plan to be able to fully accept all managed Medicare plans. The ones through Blue Cross, the ones through Humana, the ones through United Healthcare, there's a million of them. You have to be in network with all of them to accept those managed Medicare plans. You don't have to, you can just accept pure Medicare, and we'll talk about that on our next episode. But you should know that if you want to be able to offer all of them, you have to be in network with all of those insurance companies. So what about secondary insurance? It really depends on what folks have. Some folks might have really nice secondary insurance that picks up the other 20%. It picks up their 20% co-insurance. Some folks might have a secondary insurance that also has a deductible. So the claim goes from Medicare to the secondary insurance, and the secondary insurance says this person has a deductible. You need to charge them whatever. So there can be a lot of nuts and bolts with the secondary insurance as well. So that is essentially what Medicare is. It's a federal program. It's nationalized healthcare. For most people, they're going to be folks 65 and up. They become eligible the first day of the month that they turn 65. Most folks that we're going to see in the outpatient environment are coming in with Part B benefits, which means they do have a monthly premium. So again, if they're having trouble with their Medicare, it's probably because they haven't been paying their premium, and it is not 100% free government healthcare. It works on an 80-20 split. They're probably going to either have a secondary insurance that pays that, or they're going to have to pay it to you in cash out of their pocket as part of their co-insurance copay. Now, you might be asking, that sounds really convoluted. Why do I care? I think the most important reason from an aspect of physical therapists helping people and also attracting business is that 70 million people have Medicare, right? A third of the country, essentially. If we throw kids out of the equation and we just talk about adults 18 to 54, adults 55 to 64, and adults 65 and up, 70 million people have Medicare. That's a lot of people, right? That's about 1 in 3 adults that you see around on the street are going to be Medicare eligible. So that's a huge pool of people that if you don't accept this, you need to have a reason why, because they're going to ask, or you need to have a plan to accept it, one or the other. You can't just not know anything about it and not accept it. You need to know where to send those folks. If you don't plan to accept this, we'll talk about in future episodes how physical therapists can't opt out of Medicare and take cash from Medicare eligible patients, or you need to take it yourself so that you're able to offer services to these people. So it's really important to know that this is a huge pool of people that's only growing, right? Our population very soon, in the next 10 to 20 years, is going to be very top heavy, age 65 and up, where we might even get close to maybe 50% of people being Medicare eligible. So again, a huge pool of people that we need to be able to offer services to by billing Medicare, or have a way or a resource to send them to if we can't, so that they can still get high quality care. So in a nutshell, that's Medicare. We'll have 3 more episodes where we talk about how to bill it, how to get enrolled, what it looks like payment-wise, and then we'll finish our last episode, as we talked about, with tips and tricks around documentation, around what needs to come from a physician. Can you see Medicare patients, direct access, and all those sorts of questions. So stay tuned here on Thursdays. And then if you're a virtual ICE member, our plan is to connect all these episodes together into one virtual ICE session next year, where you can just bookmark the video and use it as a resource anytime you have questions on Medicare. So I hope this was helpful. If you have questions about Medicare, how to take it, how to bill it, what it pays, please throw them as a comment on Instagram or the YouTube video. We already have a great pool of questions to answer for later weeks, but we're happy to add more in. So please, if you have questions, comments for discussion, let us hear it. Other than that, I hope you have a fantastic Thursday. Have fun with Gut Check Thursday. Have a great Mother's Day. Happy Mother's Day to all the mothers out here this Sunday. And we'll see you next time. Bye, everybody.